pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Well, welcome to the first study session of the month of July. We're rolling along this year. Do you folks out there at Horizon want to talk about the ambulance first?
Sure. Your report's in front of you. For June, we had 237 911 calls, up from 205 the year previous, pushing our average to 7.9 per day. Remained within all of our contracted times. You can see our emergent and non-emergent transfers there. The treat no transports were at 49. Hospital to non-hospital transfers were at 26. Public assists at 7, 1 appointment. We had 5 classes reaching 35 students, 15 mutual aid intercepts. We do get called, that you'll see that looks up a bit from previous. Jesse's been checking my math a little bit closer. And so I never counted requests and canceled before we got there. He is counting requests out of our district and whether they were canceled or completed. So you can see we had 15 times. A lot of that is a trip to Chrisman. We will get called for an intercept to Northern Edgar County, but Jeremy will disregard us and he will take the call himself. And then we had 8 public relations events. Haven't completed, it's still early in the month, so we haven't completed all of our QI data there. Of those 237 911 calls, 221 of them were fully completed, and of those 221, 155 went to Horizon Health. The 40 were the treat no transports, and then you can see that Union Hospital was the second highest transport at 14. Any questions on June's numbers? We're in full prep for Fair Week. Jesse's learning some baptism by fire stuff here. We had, I think I reported 2 weeks ago that we did have a deer versus ambulance accident that it has gone in for repair. We hope to have it back by the end of the week. We have Medic 1, our quad cab ambulance, is getting rear shocks placed at the beginning of next week. So we're just playing rotating ambulances in service right now. Any questions for me?
On the back sheet, it was 155 went to Paris, but then there's 40, and where did those go?
Those were the treat no transport.
Yeah, you might pencil in something there.
It's an auto-generated report,
Oh,
so
okay.
it is one that I can't edit at all, unfortunately.
Okay.
I'll pay, know what it is next time.
Yep. Any other questions?
Training, classes?
Training, we have, our SAMHSA grant has proven to be successful for the EMT class that begins in the fall. It is completely full. That is a free class that we were able to offset with the cost of the grant. So $1,000 per student is underwritten for that course, and we have, I believe, 14 enrolled. We do have a wait list of 3 to 4 on there in case somebody just at the last minute decides that they can't do the course. We were a little bit more selective this time because it was underwritten by the grant, so there was an interview process. The high school class is still going. We'll have first responder and EMT course that will start up here first couple weeks of August, and both of those are full as well. I believe 10 or 12 in each one of those. And then as far as community outreach AHA, so your CPR courses, your Heart Saver, your AED first aid, we are expanding. We've been asked to host some courses in Terre Haute with the merger of Union and Regional, and so we are beginning to host some monthly courses over at our Sycamore Pain and Wellness location.
What was the thing you had at the high school, was it last week with
The RAM clinic,
the,
the,
a lot of people involved in that?
there was.
Looked like
We,
it.
I was
Nice
able to
article in the paper
volunteer.
about it, too.
Yeah, it was a nice article in the paper. I was able to volunteer for those 2 days out there. I worked in the medical division and we saw 169 patients through the medical division. People from Missouri to Indiana, Ohio, Kentucky, and of course some local. And there was
Can't believe
full
they were making eyeglasses,
medical, vision,
Yeah, I
and
saw that.
dental.
making eyeglasses, that's odd.
Yep.
Yeah.
It was quite a setup.
Other questions, topics, concerns? Jesse, do you have anything?
No, sir. Not this morning.
Wyatt, do you have anything this morning, or were you here to talk about something in particular as we discussed it, or what?
Just the battery storage ordinance, find out if that's on the agenda. I never heard back.
I just forwarded it to you.
Oh, you did? Okay, so I'll read through that. My main question was if that one piece of language was changed from decommissioning to the landowner to the company
On the standalone one,
on the battery storage standalone, yeah.
it's with Andy right now. So I anticipate a public hearing on that in October.
Oh, so
I
you're,
don't mean in September.
okay, so you're planning on doing that in September?
Yeah, well, tentatively, we're talking about doing that, the wind ordinance, and the public hearing for the solar one, all basically at the same time.
Can you have combined like that?
Well, I don't know that they'll be combined, but they can be one after another.
Just boom, boom, boom?
Yeah.
Schedule one,
You know.
15 minutes apart, then they just spread out.
Mhm.
So
That way
you
we're-
don't limit the time.
Right, that way we're trying to save some funds on,
And that's fine, I just
Sure.
needed to check
Yeah,
on that one,
September.
switching that one line, that is a number one priority for my board, so. Other than that, that's all I had.
okay.
Okay. Thank you. Andy, do you want to introduce your guest?
Yeah, this
As
is your name again?
My name is Michael.
Michael from Globe.
And we're going to
Insurance.
limit this discussion to, what, about 10 minutes?
Yeah.
Yeah, 10, 15 minutes of that.
That'd be great.
Do you want me to go over some things real quick right now, or?
Yeah.
Yep.
Okay.
We want you to go ahead. Then if you want, you're welcome to stay, or,
Okay, I appreciate it.
okay?
Well, first off, I just want to thank everybody, Mr. Andy here, it's an honor that I get a chance to come in. Actually, I met Mr. Augie a few weeks back. This coming Monday, I'm working with the City of Paris. I work for the Whittingham Agency. What that is a part of Globe Life Liberty National Division. Some of our other clients also work the Terre Haute area. Vigo County is our client. I'm in the process of working with Olympia Turner at the City of Terre Haute right now as well. And also Miss Nancy down for the City of Marshall. So it's just, one step at a time. Some of our other clients that we have is like out in Terre Haute, we have like Sycamore Engineering, Honey Creek Fire Department's my clients with Chief Hyde, everything. So what we do is at no cost to the city, and also we can come in at any time. So it's not on anything that goes with, county, thinking the city right away. What we do is at no cost, we can come aboard at any time, and we provide valuable benefits. It also creates a tax savings in the process as well. So I'll just go ahead and stand. That way everybody can see. Okay, so like I said, I work for the Whittingham Agency, it's part of Globe Life Liberty National Division. We have local offices all over the nation. We have more life insurance policy holders than any in the country. We have top financial strengths in AM Best and also the Better Business Bureau. Right here is some of the major sports sponsorships that we take care of everything for players and staffing for the Los Angeles Lakers, Dallas Cowboys, FC Dallas, Atlanta Braves, and also the Texas Rangers. Globe Life is actually the name of the stadium of the company that I represent. At no cost, in simple terms, to the employers, we help attract and retain employees with much needed benefits, help the employees take care of the ones they care about, mostly their families, and also we create a tax savings in the process. So how we differ from other voluntary companies, we have a unique life benefit that's only exclusively through us, which I'll be going over here in a few minutes with you. We take a needs-based approach. We sit down with each one of the employees, talk to them, see if there's any gaps in coverage that they need to fill. Also, I did forget to mention, we do not replace anything that you currently have. All we do is help and enhance anything, so it's not like we're trying to replace any current packages that you offer. And also, there's introductory offers that we go ahead and we give each one of the employees. What those are is for each one of the employees, they automatically get free $3,000 coverage for themselves and accidental death, $3,000 coverage for their spouse, and also $1,000 coverage for a child of the age of 18 or under. Secondly, what they also get is a no-cost discount card. Gives you 10 to 85% off vision, prescription drugs, hearing, chiropractic care. It's connected to a national network with over 1,000 providers. You can also use this while they're traveling. So if anything happens, and all you got to do is go to the website, you type in the zip code that you are, it automatically generates all the providers in the area and tells them the cost that they'll be saving right off the bat. I know like Dr. Tavel, Walmart is on there, especially for vision. They get like 60-70% off just their frames alone. Eyeglasses. Also, we take a needs-based approach. The majority of working Americans would also like to get their insurance through the job for two reasons. For one, it's better, they have better options, and they also get a better price on it. So what we look at is we want to make sure that if anything happened, families are able to be able to take care of their final expenses, income replacement if anything happens, they are out of work for a while, and also mortgage protection. So our unique life benefit, what it is a group term life. It's only exclusively through us. What we did is we actually combined a term policy and a whole life policy together. So with that being said, it covers you all the way to age 100. Has an option to be paid off at the age of 65. Coverage continues to for the employee after they retire. Premiums never increase, and also benefit amount never decreases. Everything is all of our products that we offer is 100% portable, so nothing ever terminates. So the employees can take it with them if they switch jobs or retire or whatnot. The first $50,000 is pre-tax, so it enables the employers to save the valuable tax dollars. Also, we do not surcharge for tobacco use. We look at everybody's created equally. Like right here as an example, we can do different coverage amounts with $30,000 coverage. For a whole life policy on the outside market would be like $19.24. When companies, cities, counties decide to partner with us, our group term comes to $9.99 for a $30,000 coverage. And then also, this is for a 35-year-old male, by the way, that is a tobacco user. And they get a $2 savings, so it comes out to $7.99 per week. So it's a savings over $585. So any of the money that is spent that they use, they'll go ahead and that will also save on the county for FICA and taxes and things like that. Also, this is the best policy I love. It's called a cancer endurance policy. Normally 2 out of 5 people will get affected by cancer either during their working years or even after they retire. So we have a plan that has a no lifetime max. It's got the first scheduled benefit. They automatically get $3,500 paid out to them the first diagnosis of cancer. It also reimburses and pays for chemo, radiation, hospital confinement, and also transportation to and from a cancer treatment center of their choosing. That also includes a loved one to come along with them. With this, if they end up beating cancer and cancer comes back, this plan actually picks right back up where it exactly left off. So as long as they're battling cancer, this is fighting along right alongside them. Also, what we have is a critical illness policy, and we also offer for cash for cancer. It's a cash lump sum. This is post-tax, so they can choose anywhere from $10,000 to $50,000. So that way, if anything happened to them and they're in the hospital recovering, rehab, this way they actually have some money that comes directly to them. Everything gets paid directly to the employee. Nothing goes actually to the hospitals. So this actually helps them go ahead and cover any unexpected bills, so they can pay their mortgage or any other little final expenses, things like that. The critical illness will take care of stroke, heart attack, kidney failure, organ transplant. There's a few other options that also is built into this. Lastly, what we have is an accident protector max. With co-pays being an all-time high, a lot of people do not have the extra money to afford a trip to the emergency room. So what this is, it covers everybody on and off the job for the whole family, 24 hours a day, 7 days a week. There's a quick claims portal. As soon as they go ahead and they leave the hospital, what they do is they just go ahead and they can scan the their billing slip, upload it to the system. Within 24 to 72 hours, the money is actually deposited into their bank account to help them cover any of their unexpected hospital bills that they have. Also, with our company, you do not get the employees do not get a 1-800 number or anything like that. I'm the actual personal rep, like an attorney. If anybody has a problem, everybody will have my personal cell phone number. They reach out to me. If I can't walk it through them on the phone, I actually show up in person, and I actually will file the claims for them. So how it works is we meet with each employee for a few minutes. We provide the introductory offers of $3,000 coverage for each person on the accidental death, and also the 10 to 85% discount card. We complete a needs analysis, see if anybody wants to pick up anything. If they don't, it's no big deal. They also, they'll automatically, everybody will get the 2 free ones. And then we'll offer the protection to the ones that would like to have some. So that's basically everything that goes into it. Normally, when I'm working with regular businesses, I always let them know, like, as of right now, like coming this Thursday or this Friday, I have time to start meeting with employees to get everything wrapped up. We'll discuss things with them. But since this is a board meeting, it goes a little bit different. Some of the board meetings I've been with, actually with Honey Creek Fire Department, they signed immediately. It was like, let's get the process rolling. I've worked with other ones where everybody wanted to discuss it, think about it, vote on it, and then I came back at a later time and date. Like, for example, my point in contact, and like Mr. Andy would let me know. So, anybody have any questions?
So you meet with employees. Now, it's not mandatory that they meet with you, is it?
It's a Section 125 program, so for no discrimination. They don't have to meet with me, but while the employee roster sheet, when they come, they can sign off if they don't want to talk to me. That way, it's everybody's 100% protected, and they can't say that I was discriminated against. Even if they didn't want any of the free items, and then a week down the road, like their wife passes away, and they're like, "Well, I should have took that $3,000." So nobody can come back against anybody like that.
When we had Kirk Good do this, we had a lot of issues. People didn't want to meet, didn't want to even hear about it. So we had some issues with people even signing off on it. I don't know why, but we had a lot. Now, we had the deal with the helicopter deal.
Yeah.
Everybody was fine with that one. But we tried this about, 6 months ago, 8 months ago, Augie? Remember, we had all
Year-ish.
the
Yeah.
resistance to that.
Yeah, there was,
Just wanted to make you aware
Okay.
that our folks, they didn't want to, one department didn't want to do it at all because they just didn't have time to have people off, even for short periods of time. So, I don't know, I just tell you guys so you'll be aware.
Right.
Normally how we work is we sit down with everybody, only takes about 10 minutes. We do not have to meet everybody in one progress,
Right, I
we
understand.
break it up. Also, to speed things up, I've had to bring my team in before, like we only had like an hour and there was like almost like 15, 20 people. So I brought 5 different agents with me, so we could meet with everybody and real quick to expedite the process.
So if whoever signs up for this, then we have to deduct on their paycheck, and then we write a check to you folks?
Correct. So that'd be like how Nancy takes out the payroll deductions right now.
So
for
you
the other
have
programs.
that, Nancy?
Yes, I haven't met Nancy.
Okay, good.
All right.
I just want to make sure.
Also, just to give you a little background, Like, a lot of people look at it as Aflac. Aflac's a supplemental company that deals with short-term, long-term. We're a life insurance company that deals with supplemental and also some other products as well. We also offer some things for grandchildren and children that they can select where as soon as they sign up, it's called a Career Life Plus package. It grows a cash value over time. And then also what they can do is, for example, like if the child was 3, and even if the person only wanted to put like $1 down, it would generate approximately about $7,000, anywhere between $4,000 to $7,000 to start in that package program. And then as it builds over time, it's basically kind of almost like a savings account. After it grows, the premium will never change. So even when the child's 20-some, 30-some years old, that's still the same price, but the actual face amount grew. And then they can either, if they borrow against interest, they have to pay it back. If they go ahead and they cash it out, they get the full amount. So a lot of people pick it up for their children. So if they need to pay off college or anything like that, it's an actual account that saves. Or if they keep it, I met one gentleman that just so happens that his father got with this, because we've been around since 1900, and he was 40 years old, and he was like, oh, I got the Career Life Plus, and I pay $2 a week, and now I'm sitting on like almost $100,000, and I'm 40, and I'm just putting $2 a week out of my paycheck, and you know, he's like, I'm glad that my father went ahead and signed me up for this, because there's no way that I'd ever get this price again
Is there
for
an age
something that
limit?
low.
Is there an age limit when you can sign up?
I'm sorry?
Age limit?
Certain packages, certain things do have age limits.
If
It's
you're
all,
over 80 years old, wouldn't pay to do it, right?
no, if you're over 80,
Yeah.
no, but like it goes all the way up to like in the 70s that you can still,
So it's not, doesn't
They
apply
got
to
something,
70?
I'm sure they've
But
got something special
if,
for you.
if someone's 80, actually you still get the 10 to 85% discount.
About 83.
83 will still get you 10 to 15. You can be 120 and you'll still get the 10 to 10 to 85% discount card. But also how we work is we look at everything with Aflac, like kind of like our competitor, but we're like anywhere from 40 to 60% cheaper on our prices. And also we look at things on a budget. Therefore, like easy math, if somebody makes like $10 an hour, we want their benefits to be paid off in the first hour and a half they work. So it's like between the $10 to $15 amount, and we'll actually build a package that's affordable for them that they can always keep, where it's not, oh, you know, like my premiums are super high. Because we want everybody to honestly protect their life and actually have some kind of coverage enforced.
So what we need to decide at some point is whether we want his company to be able to come in and present this to our employees to see if it's something they're interested in. The only cost we would incur would be cutting the check and our staff time, probably organizing and helping you do what.
What we do is it's called a Blue Book. It's a nice hard plastic binder, 3-ring, like you kind of keep your baseball cards in when you're a kid. And we do all the heavy lifting. The first page will have a spreadsheet, and it will tell we'll list every single employee and what their deduction amount is. And since the premiums do not increase, that's always set that way. And then we'll come back in every 6 months to a year and come in and sit down and talk to people and sign them back up, and then also meet with newer employees. And if they want to change or pick anything up or drop anything, they can do so during the open enrollment period.
Yes,
Question again, follow back around what Jeff was talking about. So if the board agrees to let you have the employee list,
Mm-hmm.
is it mandatory that they see you, come in and see you physically, or is it just where if they say, I'm not interested, they just sign off on some kind of a
Yes,
sheet?
yeah, if they're not interested, they can off the employee list for each department that I would go to. They could just sign their name next to it. That way it actually protects the county as well, and
Okay.
also protects
All
my
right.
company. So they don't have to physically
Okay.
see me, they can
Thank
just
you.
be like,
That explains that.
I'm not interested, and they can sign off next to the name.
This is group insurance, is it individual or is it group?
This is individual.
Okay.
It's a group term, that's what we call it.
Okay,
It's only exclusive through, you cannot be sold on the individual market.
okay.
But every employee, if they decide to pick up a life insurance policy or any product, it actually comes with them. Nothing will actually ever terminate. The thing of it is, if an employee does go ahead and decide to leave or retire, on the online billing part, they can just take them off the list, and it generates in our system that they're no longer here. Or they can reach out and call us and be like, Mr. Andy no longer works for us. And it's my job, then I reach out to Mr. Andy. And if you happen to go to another city or county or business that we represent, we can move him over. Or not, we can be like, okay, do you want to have this as a bank payroll, bank draft out of your check, or how would you like to proceed?
So do you wanna put this on the agenda for a meeting? Do you want to just say, well, like right now, does anybody object? How do you wanna handle it, guys?
I'd like to have not too old, but, all that paperwork, just, each individual should have that, explains all that, do you have?
Oh, yes, when we sit down and meet with them, there's packet booklets
Okay.
that we hand out.
Where you can actually sit down and read through it on your own time.
Yes.
Which
We'll-
would be nice.
Yeah, when we come in, there's a
Okay.
folder packet, and it
Okay.
explains everything.
All right, okay.
Lisa?
So if we approve this, then you would have a promotional email that Nancy could share with all employees to start this out.
Okay.
I think that would be the easiest thing.
Yeah, because I can type one out and get with Nancy, and then forward it along to her, and then it kind of briefly summarizes everything, and she can forward it to all the employees and know that we're
I
actually.
think that would be the easiest way to do it. That way they're not blindsided and it doesn't make all of the responsibility fall on the department.
That's actually how Jerry Humphrey at Hunter Creek Fire Department with Chief High. That's how we actually did that, where I sent over a brief summary, and then she let all the firefighters.
That way, everybody isn't at work every day at the same time, that makes it just easier to ensure that everyone's received it.
So do we wanna make a decision on the 21st, which would be our next study session day? Or are we prepared to go? It's fine, go ahead. Or do you wanna do it less formal or more formal, I guess is what I'm saying.
Also, can I just mention one other thing? I just thought about it. Because first off, I have to do is get the county pre-approved of the paperwork. But nothing is actually 100% binding. So if you want to take some time, like, I'm sorry, sir, what's your name?
Jeff.
Mr. Jeff mentioned, we have two options. For one, we can fill out the paperwork and I can send it in and get it just approved. And then work off the email thing with Nancy, how Lisa, okay, how Miss Lisa said. Or if you want to wait till the 21st, I can come back and we can go that way.
Does it need to go to formal county ordinance meeting?
I
No?
don't think so.
We're not expending anything, but,
Okay.
I mean, I just don't wanna try to ram through something, because this is the first I've heard of it too, so. Whatever you guys are comfortable with. Or if you wanna think about it till Wednesday, then we can just kinda discuss it for a few minutes on Wednesday.
Let's do
Under
that.
committee report.
Let's do that.
How's that?
Yeah. And that way, it gives us a chance. Nancy will be the one
Right, I need
with
to
the,
come
yeah,
look.
talk to Nancy about,
Lisa or I need to talk to Nancy and
right, make sure she's all right with it.
let's do it that way.
Do it that way.
We'll have him answer on Wednesday.
Okay.
Unless something pops up, okay?
Not Rob, I actually have one of the employee booklets in my car, if you'd like to have some information in your hand.
Yeah,
Yeah,
that'd
okay.
be good.
I'd like
Okay,
to go over there.
I'll run out
so
and grab
that's
that
the
for you.
plan, okay? We appreciate your
Well, I
time.
appreciate you having me. Let me run out and get that, and I'll put
Yeah,
Get
we'll
that
just
for you.
go ahead with our meeting.
Okay, I'll be right back.
All right, thank you.
Thank you.
Andy?
I got a call from Nancy this week, and she was interested in some of the employees that asked what health insurance, if we had any idea. So I called Kirk and talked to him. He got back. Have you talked to Kirk at all?
I've been out of the country.
Okay. He got back with me, and I think it's 19.7% increase.
Oh, I didn't know he even had that yet.
Yeah, well, I told him to get it. He got back with me, but that's the number, you know how it goes.
Well, that's when we usually go, no, we're
No,
not
we're not
paying
gonna
that.
do that, right. So that's where it started. So we gotta whip on him, see where we can get him down to.
Well, and if we want to bid it, of course, it goes into effect October 1, but we have to do all of the preliminary work in August, late August and September, correct? So we're on a tight leash to bid it. If we should want to.
Right.
Well, we've moved on to other things, so just leave it with us. and we'll
Oh,
go
I'm
from
just
there.
writing some information in there for you.
All right. So, any,
I mean, that's what we're with. I don't know whether, I haven't had any interest from anybody that I'm aware of that is interested in bidding on it. But usually I get people reaching out to me, but I haven't had anybody this year. So, anyway, that's where we are with that.
Is that Blue Cross Blue Shield?
Yeah, well, and Health Alliance is going out of business.
Yeah.
So there's not, the market,
the market is squeezing.
yeah, it is.
Squeezing down. Don't forget, we have a meeting at 11 o'clock on Thursday. And Michael will be in town. Michael is going to also do the checklist for warranty on the courthouse. So as he gets on Wednesday, I'll let you know when he's gonna be here. So if any of you would like to be with Michael as he does that, or have any questions, that we can deal with it then, okay? Landscaping,
I haven't heard back from Dusty. I got him, the ball rolling on that, but I haven't heard back from him, so, okay.
Well,
Great.
it's been a pleasure. I'll let
Thank
y'all
you.
get back to your meeting.
thank you.
And I hear from your women, Jeff,
Take care.
Lisa,
Carl?
Carl,
Mm-hmm.
Russ.
Russ,
Tim.
Tim, and Augie. All right, yeah, I forgot about y'all.
Thank you.
Thanks.
Y'all take care.
You too, man.
All right.
All right. So,
That's all I got.
and some of them, they were gonna also look at the pipes coming out and maybe addressing how the PVC pipe looks on that west side. And he never did get back with me on that.
Yeah, I'll give Dusty a call.
And you guys have, some of you have heard some folks going, what are we doing? And what's going on? So, I mean, I don't think anybody's unhappy, but we need to address some of that stuff, right? Okay. Are we, do we have any plumbing issues at the bottom of the courthouse? The men's John specifically, or is?
Yeah, I mean, there's no plumbing issues. There needs to be some stuff needs to be done in those bathrooms. I need to get back with the sheriff and see what he and Gary Jewell, he called me and was down there with Gary. I don't know what Gary's response was. Ray had told me he had looked at some of the stuff in the women's bathroom, and he thought he could do it. I just need to get with Ray and see he's getting a lot on his plate, I don't wanna overdo him.
Well, one of the things, based on what you just said, we need to make sure that the sheriff doesn't just go out. We need to somehow know what's going on there. If, I'm sorry, we don't
Right,
wanna
no,
be committing to a $20,000 deal,
Right.
without knowing what's going on. Right?
Right.
And how about Monty's deal upstairs? Any further on that?
I don't
His
know about
restroom?
his restroom.
Yeah, remember.
As far as I know, that got, Monty's, it was
No, but
it was the, yeah.
Well,
got
Probation.
fixed.
You're thinking about.
The
in
judges.
The judge, in
And I went
the
up
jury
there and
room.
fixed.
no, I'm talking about.
I know, that's what you were thinking about, but he's talking about Monty needed something done.
They haven't had a restroom work for
Right.
2
Right.
years.
Right. I'm guessing nothing got done. Are we waiting on Jason?
I think we probably ought to move on.
Yes. I mean, nothing against Jason, but it's just, he's just swamped all the
Yeah.
time.
Yeah.
Yeah. I know Scott Blair was up there doing the stuff in the jury.
And I had
room.
asked Ray if Scott was interested in doing that, and Ray hasn't gotten back with me.
Okay. I know I went up there a couple weeks ago and he had it tore apart, but I don't know whether he's got it back together or not.
Okay.
You mean, okay,
In the
well,
jury room.
in the jury, he's got that fixed as far
Did
as
he?
I know,
Okay.
yeah. 'Cause
So
I
they were
went in
getting
there
ready to have a possible jury trial, and that's why they were wanting to get it done.
Okay. As
See,
far as
I
know,
wasn't
that
aware
was
of the
fixed.
jury room having a bathroom problem.
There was a leak in the wall.
Oh, okay.
As far as I know, that, it was fixed. It wasn't leaking when I was up there, and I talked to the,
We'll check on things when when we have our county board meeting,
okay.
see what's going on with
Let's see,
everything.
get hold of Ray and just see where he is on stuff.
Did you try, Hat Plumbing, Jonathan Jones?
What about it?
He's usually right on it.
Yeah.
You call him usually at our house in the afternoons.
That's true.
He likes old people.
Jason doesn't like the county, so I wouldn't count on him.
Jason doesn't like the county?
Huh?
Jason doesn't like the
I don't know,
county?
he wanna get on the health department board, he's really,
Nah, he's,
I don't know.
he's cooled down.
I've seen him there every day.
He said, no.
I've seen him
He
every day.
just likes to aggravate you.
I know that, in my high school.
I mean,
I gave him D minus just to get him out of class.
speaking of you, what's, you've got a meeting?
We got a meeting at noon, so I'll have some stuff for you on Wednesday, probably.
All right.
That'll
Russ,
be there on the phone, so.
Russ, you got anything? Augie, you have anything?
Not specifically, unless anybody has a question for me.
Okay. When petitions are gonna be due up here in what, 2, 3, 4 weeks?
Yes, I just received, late Friday evening, the official candidates guide and the election calendar, so, and honestly, I haven't had time to open that up yet, but yeah, as I mentioned a month or so ago, they've moved everything up
Right.
a month.
So maybe on Wednesday.
You'll have that
Oh,
information
absolutely.
for us.
Absolutely, I'll have it Wednesday morning for you.
Cool,
Okay.
thanks.
Yep.
Carl,
Nothing.
Lisa?
Yeah. Methane information, did you find out who it is, the company?
Not yet.
Okay,
I got that text message
yeah,
and I haven't got that information yet.
okay.
You got my text about the gases are produced when they burn up
Yes.
methane? Okay.
Right. Yep.
Okay. I looked it up on the internet.
Yeah, because when I last talked to Bill Menace, I told him that I would look into it.
Okay.
And I know from that, if we can get the information on the company, or if not, there's a guy in Indiana that owns a lot of that, well, there's 3 different landowners that those methane gas well, where they're burning it off. 2 of them south of Sanford, and then 1 east of New Providence. It's all on the Green Valley Mine, but I will work on it this week.
Okay, just didn't wanna let it
Right.
slip away. I note that one thing that we're gonna be voting on is the Paris Fire Protection District.
Yes,
So is this the fourth and there will be five, or is this the
we
only
have
open
not done
position?
anything. Nothing's been done about expanding the fire department
So,
to 5 people.
okay, so this one is just replacing one of the three.
Well, he's
Right.
actually
No.
being reappointed.
Reappointed.
Reappointed, okay. All right, because you know I'm gonna ask about that.
Yeah.
All right.
I talked to the fire chief, and I don't think there's any interest at this time to go
Okay.
with
Okay.
add additional people.
Okay. That's good. Good for me to know.
Yep.
Yeah, it's been kind of, whatever.
And as far as Hume, we haven't heard anything more about expanding that one either,
So,
correct?
no, not anything.
Okay.
So, if they're not interested, we're not interested.
I don't have anything else. I'll go visit with Nancy after this about.
Okay.
Oh, Lisa, excuse me, I'm sorry. I should have mentioned, I did talk to Nancy this morning, invited her
Yeah.
to this meeting, but she's got payroll going on this morning, couldn't get away, so.
Yeah, I ought to check in with her anyway, so.
All right. As far as the agenda, everything is fairly self-explanatory. Glad you had the reappointment of Ben Lucan. Questions? The number 13, there's no money in that account that I'm aware of, the last I looked. So, but they've requested for Christmas Days some money. I think we should at least look at their request and let them know that we simply, through Augie, let them know that there's no funds in that category to distribute. So, but just out of courtesy, we'd at least discuss it.
Could we give them some money anyway, is that possible? I know that's through the motel, right? They don't have anybody staying up there, so I don't draw any money, but maybe we'd give them a little bit anyway.
Well, we have 2 bed and breakfasts up at that end of the county.
Yeah.
And we have discussed it before about sending a letter out. I'm not sure that they're collecting the
Yeah,
tax
right,
money.
right.
So that's something the state's attorney could address.
I just thought mentioned to be nice, maybe.
Well, I don't see how we could do that without a specific fund.
Oh, yeah, true.
Because
Yeah.
we would wind up.
That's true, yeah, that's
Right.
true.
We're talking tax money.
Right.
So,
I agree.
Yeah, that, when you said they didn't have any money, I thought, well, you still got those bed and breakfast or whatever they're called. I assume they're still operating.
right, well, what's going on though is some of them are operating and they just don't collect it. So I think they need to be reminded that
Yeah, do it.
they have a responsibility to collect that.
They used to have money, we used to have 3,000 or 4,000 every year that
Well,
we would give them out of that
300 or
fund.
400.
Sure, yeah.
well, it was up to a couple grand at one
Yeah,
point, but it
right.
took a while to get it there.
Right.
Okay.
And we had the old brick, or
We'll check in.
yeah, the old brick inn was always very good about passing on tax
Yeah.
money to us. And since that point, of course, it's closed up a while ago, and you've got 2 on 36, one to the east towards the Indiana line on 36 and one to the west, out in the Hume area. So, at any rate, we need to do something there. I think they're it's scheduled for them to start pouring concrete today, pumping concrete. I didn't see a concrete pump.
Yeah, you did or
I
didn't?
did not.
See one either.
I didn't see one yet, so I don't know where we're at on that, but. All right, anything else to come before the meeting? I have no idea when tax bills are gonna come out. I don't know. at
How's
this
Donald
point.
doing?
He's
Be back to
doing
work?
okay.
Is he working?
No, oh, no,
Okay.
so. All right, motion to adjourn. Russ moves, Andy second. All those in favor signify by saying aye. Opposed, nay. We are adjourned.